So good afternoon, everyone. Thank you for joining today's session. Before we get into the discussion, into the session itself, I'll take a few minutes, to quickly introduce Dr. Suganya. Dr. Suganya practices internal medicine in Detroit, Michigan. So before her current assignment, she was actually working as a general practitioner in India. She has also done research on infectious diseases. Maybe Sukanya can explain it better when she gets into the session itself. That's all I have more as an introduction for Dr. Sukanya. Without much ado, I'll hand it over to Dr. Sukanya to take it over from here. Over to you, Dr. Sukanya.
Thank you, Chris. Thank you. Hi, everyone. Thanks for joining. Again, as Mr. Salman Kumar said, my name is Suganya Chandramohan. I'm currently doing my internal medicine residency in Detroit, Michigan. Before that, I was doing a few researches in infectious disease, again in Detroit. And then prior to coming to the US, I was working as a general practitioner. So I guess I can get started with just like very briefly, I'm going to talk about this virus, and then straight away I'm going to go to the question. And I would be happy to, as the question flows in, I would be addressing that as well. So COVID-19, it is the name of the disease caused by a virus called the coronavirus, which is, it's not the family of the virus is a known virus. It's not like a new virus. And we have known coronavirus to cause most commonly is the common cold, like especially not the flu or the RSV that some of you might know. It's most commonly causes the mild common cold. But, this virus it has like many, to be put it in a simpler term, has like many sister viruses, and those are those sister viruses, they gain like extra power or extra strength, and they can sometimes cause this pandemics that we are expressing. As you guys might know, this virus has previously caused something called as SARS. It happened in like 2002. Majority of them were in China again, but then it resulted in the pandemic as well. The second time, the other issue was the MERS, we call the Middle Eastern Respiratory Syndrome. I think that happened around like 2012, and that was mostly in the Arabian Peninsula. And now the third, implication from this virus is the COVID-2. I think the other question so right now we are in the pandemic, but, last month, I should say, at least in the end of the February or the beginning of March, we were at a very worsening stage where there was a complete spike of these cases that was happening. To give like a brief timeline of how this started is like in December 29, there was a severe cluster of pneumonia cases that was reported in Wuhan, China. And around like 30th of January, the World Health Organization, it's like a public epidemiology organization, they reported that, this is a public health emergency in China. But within like a short period, like around March 11, 2020, the WHO declared it as a pandemic. As of today, I know in the US we have around like 600,000, to be precise, it's 690,000 cases and around 35,000 deaths reported. And the major hit we have seen is mainly in New York, New Jersey. Until like last week or early last week, I would say Michigan was like the number 3rd, but I think Pennsylvania is kind of beating with Michigan around. So that's what is happening. And how the virus spread is mainly, just so you guys know, although this is, as I said, this is an old virus, but the pandemic is new. So the virus pattern is still something that we are studied upon. So most of the recommendation that the CDC or, the medical journal are giving is based on the old ways the virus has been spread, and also based on influenza, which is also very commonly known to cause pandemic. I think if any of you remember, in like 1980s, to like 1920s, we had like the Spanish flu, and around like millions of people were affected by that. I would say, if I'm not wrong, around like 50 million people worldwide actually died of that Spanish flu. And so all the recommendations basically that's coming on are based on these virus trends, because right now it's a very new virus. Only 3 months has been with this virus being ongoing. So we don't know the full details of this virus, but given it's an RNA virus belonging to the retroviridian family, we can say how they behave in general. So basically, they spread mainly through like respiratory droplets. That is, like if anybody sneezes or cough, or even sometimes if you're a spitter, you can spread it through the saliva and the sputum that comes out of it. And anyone who is close to you can get that infection. The virus to you, and you can develop the infection, or I will talk about what happens if you don't develop the symptoms. So the reason we say social distancing is because this virus, it again, based on what we have so far, if it's a respiratory droplet spread, it can be around like a 3 feet distance that the virus can infect. So that's why we are asking to maintain a 6 feet difference to be more precautious. Like we are asking double the distance to maintain, just so we can avoid the spread of it. But there is a new theory going on that this can be airborne as well. Again, this was there initially when the virus came in. They were saying it could be droplet as well as airborne. So airborne means like the virus stays in the like once you cough, just not the droplet, but it stays in the air, and whoever goes into the room of that infected person can inhale it, not directly from the person who's coughing, but from the air. And but that is kind of debatable at this time. So that's why we are basically sticking to the droplet precautions, which is going on with the 6 feet distancing. If you're taking care of a sick person, to wear the mask and again maintain the social distancing with them. And obviously, when somebody coughs or when Steve sneezes, it can it actually spreads very diversely. I did this on a previous group that I just wanted to show them how it's done. Again, I think it's no harm in doing it. So if this is the person, who's next to me, and I'm the person who's coughing, I just want to show you guys how it's. So when I cough, I'm pretty much going to be like, there we go. So when I cough, and this is the person who's obviously is less than 6 feet to me, so this is what happens. So I'm pretty much, it sprays, it's like a spray that comes out, and I'm using a color to just so you guys can see, but in general, it is not seen through the naked eyes. It's very, very tiny. It's like less than 5 microns. That's how it spreads. So you cannot see it with the naked eyes. You have to use like microscope to actually see it. So when this happens, when somebody just coughs, it's not just the person who's next to me going to have it, but it's going to go to the surface as well. And if I'm going to touch the surface, or if for example, I'm going to touch the infected surface and I'm going to touch my face, or I'm going to give a handshake to somebody, or I'm going to touch somebody's face or somebody's hands, that's how the virus spreads. So that's the second reason why we are emphasizing on the fact to do like hand hygiene, which is like washing your hands frequently, especially after touching this commonly used surfaces. Because, for example, I am touching a doorknob and I have this, this virus in my hand, and I'm going out. The person, like my husband or my son, is going to touch the doorknob next, and it can come to them. I'm going to talk again about how long this can last, but to go in the order of descending, the most common or the most effective way we have seen people getting infected is through direct person-to-person contact. The number of cases that's been reported so far through the indirect contact has been very minimal. Again, we don't have the complete set of epidemiological reports that's happening in the US. So those information will be something we will be getting later on. But it is hypothesized, like it is, it has been told that it could spread through, through to surface as well, but the primary means has been direct person to person. So the common way to avoid the spread is, as I said, one is maintaining social distancing, 6 feet distance, and second, to wash your hands frequently, and third is like cleaning this commonly used surfaces. I would also advise to all the software engineers here, like, cleaning your laptop is also one of the commonly touched surface. Obviously, I know you guys might not share the laptops, but if there is a child in your home and you kind of touch your nose unintentionally and then you work on your laptop, there is a probability of you getting the virus in the laptop, and if your child plays on it, he can get it through. So just cleaning the keyboard once in a day or so would be efficient. Again, it's not very clearly shown that the infection spreads through these ways, but it is advised to be safe. Prevention is better than cure. Let me see what other questions were there. And
So I can read through the questions, Doctor, if you want.
Sure.
Okay, so the first
I think one of
question
the
is,
other questions was, yeah, go ahead.
so the first question that I could see from the Google forums is like, can you explain the day-by-day symptoms for COVID?
Okay. So this is, I'm not sure if they're asking how the symptom progresses or what is the common symptoms. I'm going to answer both either way. So one of the symptoms in COVID has been very diverse, especially when we were comparing the symptoms in patients in China who presented to US. It's pretty similar, but US has some more additional symptoms. So, but what are the common symptoms is, one, since it's spread through respiratory droplets, the primary symptoms will be usually upper airways infection. So, symptoms. So it could be like you can have some runny nose, you can have some sore throat, you can have some cough, which is productive, like you're producing something, or non-productive, like dry cough, we say. Fever can also be there. Shortness of breath, like you're feeling difficulty of breathing. That is something unusual from your normal. That is what we say. So if a person, or even before this pandemic started, has difficulty breathing, walking around a few steps, which is seen in some of the elderly patients or patients with heart failure, patients with pneumonia, like smokers, COPD, asthma patients. So if that's your baseline, it's not that you have the infection, but it's something more worsening from your baseline. So basically, for me, I can walk normal, and all of a sudden, I feel very short of breath just walking few steps or walking, like taking the stairs. That's something concerning, and other symptoms. I think I already told about the fever, cough, shortness of breath. So when should you seek medical attention? As I said, when you feel the shortness of breath that is not your baseline, that is one time you have to, you have to seek medical attention. And second is, if you feel like you have like some pressure or like persisting pain or uncomfortable situation, like a sensation in your chest, that is also something, that's also when you will need a medical attention. And sometimes if you feel like you're really sleepy, you are like sleeping more than your normal, or if you see that you're getting confused, or if you see, this is more applicable to people who have other comorbidities, especially like if they have heart failure, diabetes, obesity, COPD, or asthma, and patients who are more than 60 years of age. These are the patients, because especially in elder people who are like more than 60 or like 70, when they're not very monitoring themselves, if you see them, like you see like that's not their normal, you feel like they look confused to you, those are the times you have to be alert about. And also, if you think your lips or your face is like bluish, this is very hard to be seen among brown skin people like Indians like us, but that's something to be noted as well. So what to do when you see these the red flag symptoms like high fever? I would not, if you're feeling, another thing is like, if you think you have a fever, one of the recommendations I want to say is like, please check your temperature at home. I really hope you have a thermometer at home where you can take your temperature, because that's how it will be helping us as healthcare worker to address when you call us. Because the first thing we are going to ask you, if you call us and say like, I think I have a fever, we are going to ask, have you checked your temperature? So if you can check your temperature, that should be really helpful. And usually when the temperature is more than like 38 degrees centigrade or 104 degrees Fahrenheit, that's considered to be a high fever. And then again, and you feel the shortness of breath, and if with or without the fever, dry cough, which is getting progressively worse, and confusion. What to do at this time? For people in US who are in the United States, I know like you usually have like a primary care provider, and I know you don't follow up very frequently with them, but they are right now there is an option to do like a telehealth. So you can call the clinic and you can tell them this is what is going on. And as far as the hospital I'm working in, we have the option. The doctors call back the patients, do like similar to like the Zoom, like a video chat where we talk, and we ask about the symptoms, and if it's something concerning, then we definitely ask them to come to the emergency room. If even if for sometimes you feel like this symptom is so bad, like especially the chest pain or the chest discomfort, and the shortness of breath where you cannot breathe, you feel like you are breathing really fast, you can also call the emergency department. I know again in the US we have the option of calling the ED, and they do the triage, and they tell you, if you really have to come to the emergency department. For some of the people, the mild dry cough, mild fever, like less than 38 degrees, sometimes in a day, and, a mild runny nose, you can just actually monitor yourself at home. You don't have to go to the emergency department as long as it's like controlled. Just monitor yourself. I would also advise social distancing. Don't, go to shops when you have these symptoms. And if you have kids, if you can, avoid contact with them or like stay in a separate room, do so. If not, wear like a mask, especially if you have this runny nose and you're coughing, because you can be spilling out the germs. So those are the things. So how the symptom progresses, I think that's what he meant by day-by-day symptoms of the COVID. So again, it's very variable. For some people, the first hit is the respiratory distress. Hello? For some people, I think the first hit is the severe shortness of breath. They don't even have the other symptoms, or the first symptoms is like mild fever. Then they have this confusion. Again, as I said, it's more in elderly people, and it has for some people it has this mild symptoms and it's gone away as a mild symptom. So it's not like you'll have the mild symptom and it progresses to severe symptoms. It happens in some patients, but I've seen all the way. So I've seen people with mild symptoms who we have advised to stay at home, constantly monitoring. And I've seen with people rapidly progressing to severe symptoms and coming to the hospital for further care. And, some people starting first off with the severe symptoms. I think the major risk factors for people who to start with the severe symptoms, as I said, are people with heart conditions, because, remember, although COVID is ongoing, there is still the other diseases which is still happening. It's not like other diseases are taking a vacation. So there's still heart attack happening. There's still asthma exacerbation. There's still stroke. Everything is still happening. So that's why we say when you develop other symptoms, which is red flags, such as like, confusion, shortness of breath, chest pain, do contact your healthcare providers, or you feel like it needs emergent attention, you can always go to the ED as well. I can go to the next question. So I think the next question was, if someone gets a doubt of getting contact with COVID, what should they do next? Okay. So a part of it I already answered, like if you feel like you're having getting a doubt of contact with COVID. So people who are at high risk are, one, as I said, are those risk factor people. Second, if you do have contact with somebody who is tested positive, you are a high risk, okay? And usually when we find a patient who has positive test, we usually also advise the family members to maintain social distancing, and we ask them to, watch for their symptoms. I know right now CDC and other, healthcare providers, healthcare facilities are working to do testing for these, the contact families as well. But at this time, it's still working on. I know in Michigan we are doing few. Again, it depends on which state you're from, but if you did come in contact, so you should be like a primary person. So if, for example, if I am positive, then I would advise my husband to watch for symptoms, to avoid any social gathering, avoid any contact with anybody else. And if the test is available, he can also be tested for it. And the second question is, who do we contact? So as I said, I know in Michigan, we do have multiple remote testing centers available. Let me see if I can share this, or if you guys can log into, it's called the MDDHS. Okay, let me try to share the number here if I can. There we go. So this is the COVID testing that's available from Michigan. So it's called the michigan.gov coronavirus. So here you can actually enter your zip code or your address, and you can find the testing center that's near you. But again, they usually don't recommend you to go to the testing center directly. They would advise you to call this number, so they do the triage for you. And once they do the triage, and then if they think you meet the criteria for getting tested, then that's when they call you back. They call you to come tested. Okay. So Mama, can you read the next question? Here we go. Okay, I got it. I think in general, there is also, if you're not from Michigan, you should have, for example, in New York, the public radios or news will always have the number. And in CDC website as well, you can look for your locality testing center just by typing in your zip code, and they will give you the reference. So I hope that helps.
So there's one more question. Yeah, so there's one more question related to the same. I think, that is also answered. Yes, the next question is, should we disinfect the groceries before bringing home?
Okay. So for this, I'm just going to tell you, what, as I said, this virus, it can, so when it spreads through respiratory droplets, and it can, stay in the surfaces. So I'm just going to give you a timeline that's been studied upon. So when in the air, when we cough, or when we, again, this is not just for this SARS-CoV, but it's based on this virus family, how it's been behaving. So when you cough, it's shown that the virus can stay in the air for around 3 hours before, it becomes, the infectivity goes down. Second, the virus is shown to be in plastics as well as, in plastics and steel is the second area where the virus can also stay. That is, again, when somebody coughs directly and it stays in that area, that's how it can spread. And it can stay in plastic and steel for around 72 hours. And paper and cardboard and copper has shown to have lesser duration. But although I said this, it's not been shown that the virus, the current epidemic or the pandemic that's happening is through these spreads, it's through the plastics or the papers or the airborne. It's mainly through direct respiratory spread. However, we are still recommending you to clean the common surfaces. Regarding the groceries, yes, if you want to be highly precautious, One advice is to leave them outside, the non-essential stuffs which you don't have to bring inside the house immediately, to leave them out for at least 2 to 3 days, because although the virus is there for 3 days in these plastics, the infectivity is kind of decreases around like 12 to 24 hours. So that means like it cannot be infectious to somebody. So usually that's what, again, this is not an official recommendation. These are just hypotheses. So if you really want to be cautious, you can leave unessential items outside for like 3 days and just bring it in. Or you can clean the outer surface using any disinfectant that has more than 60% alcohol, which is the common disinfectant that's available. And if it's, milk or products that produce that has to be in the freezer, again, just clean the outer surface and keep it in the freezer or the fridge. The thing is, like, although we have the habit of cooking these foods really well, so again, it's not complete protection. So cooking the food well has shown in previous viruses to reduce the infections and reduce the disease happening. So it is advised, especially if it's a milk, just warm it, food, reheat it very well, like cook it in the stove really hot, because these are shown to kill the bacteria or the viruses. Like the typhoid, the cholera, how did we prevent this is by cholera is mainly spread through fecal-oral, like through food. So the main advice, we warm the water really hot, and that killed the bacteria and the viruses. So we are just following those guidance. So yes, you can try to clean those surfaces. I know most of the disinfectants, some say it kills coronavirus. I don't know if you've noticed that, but as I said, this coronavirus that's happening is not the same coronavirus that causes the common cold. It's a sister or like the more stronger one. So even though it says it's not addressing the pandemic coronavirus that's happening now. Next, I think. So yeah, how is the testing done in Detroit and Oakland County? And there are many articles that says testing. Yeah, so I think I addressed that previously. I know a lot of new test centers are available. These are mobile test centers. So again, it's not advisable for you to go directly to these test centers, because we are short-staffed, because we need more healthcare providers everywhere. So we are we are trying to recruit more healthcare providers to help us with this. In fact, at this time, it's not just the internal medicine doctors or the intensive care doctors, like the ICU doctors who's working. We are actually getting help from the subspecialties, like super specialties, like psychiatrists, dermatologists, everyone. We are seeking help because we are short-staffed, because the infection is so fast, and the number of physicians is not that adequate. And so it's always advisable for you to call the hotline. Again, the number is, it's available in the michigan.gov. I can share it. Let me see if I can share it here. I'm just going to copy paste it. So if anyone is, they can try this. So you have to just type it, and please call the hotline number. And I know it's 24/7, but it depends on which area you're going, and the timing might be different. Second is they kind of triage you. So at this time, we have not started the contact tracing. That's when we do like tests for everybody in the community. I know as of Friday that was not started, but that would be one of the plans. But right now, our priority is to test everyone who is in contact with a positively tested COVID patient, and also who is showing symptoms. So if you really feel like you came into a close contact with somebody who tested positive, and you are developing some symptoms that is getting worse, or like you're having severe symptoms, definitely call them. You can also call the nearby emergency department you have, and they will also guide you, because right now I know a lot of emergency departments have set out camps outside the hospital to do just the testing. So they will actually guide you to how to proceed further. As always, if your symptoms are mild, you can always call your primary care doctors to discuss about this, and they will also help you, guide if it's really something to be tested or if it's something else. Because, even, for example, gastritis, they can cause some chest discomfort. So, we will be gauge you, direct you in the directions of testing and treatment. How do I know whether I have a good immune system or not? And can fasting research recharge the immune system? Okay, so as I said, if you are a young person who does not have other comorbidities, your immune system should be pretty good. That means your immune is, that's why you don't have the, well, I don't want to say that way, but if you're a person who is young, usually less than 50 years, and you don't have like heart problems, diabetes, hypertension, obesity is also shown to have a risk factor, or what did I miss? Asthma. Then your immune system should be really good. Should be good and should be fighting against the infection. And what was that? I think fasting. There's no research that has suggested that can fasting recharge the immune system. There's nothing that's shown that this is what can recharge the immune system. Basically, in general, your immune system is good, and fasting has not shown any effect. I know there are some immune booster diets, not even diet, food you can take. Again, these are not that has shown, yes, if you take these, you will not get the disease. There's nothing that's proven so far. Like, I know a lot of surge has come on vitamin C and zinc, but this is not something like, one, we don't have a research that's comparing patients who took vitamin C and zinc and patients who did not take. That is, we call it like the case versus control studies, which is not available. And I know we do, when we have patients, we do give these supplements, and I have not seen any research, any difference among these, but I know vitamin C is an immune booster. So in general, it kind of increases immune production. And vitamin C, you don't even have to take the supplements, because I know we have short supplies. Even eating like grapefruit or oranges, these are rich in vitamin C. And garlic has some kind of selenium in it that is an immune modulator. So, I know a lot of Indian food has by itself like the herbal immune boosters, but again, these have not shown to be 100% like protective. So what I'm trying to say is, don't think that if you take these, you don't have to do social distancing, you don't have to wash your hands, or you don't have to wear your mask when you're in contact with people. That's what I'm trying to say here. And the next question was, can I take this kids to the swimming pool or other people gathering places? Okay. So I think there was another question on this also. So I'm going to just say how this, after May or whenever this lockdown comes, it is a very mitigated process. And again, it will differ from state to state. But, since that mainly because the number of cases is not evenly distributed all over the state. So as I said, New York is leading, and Michigan was we are currently in the 5th or 6th in the number of cases. So the mitigation process will be different and how it happens. But as of now, if they do take the lockdown down, I would not recommend taking the child to a swimming pool that is commonly used by other people until it is cleared by the government that yes, it is now safe. So I think that would be in the very end of when they release the lockdown, they go step by step. So the last step, or like the near step, would be last but the before step would be this swimming pools or the social gathering, because they will try to mitigate things that is very important in the beginning. So probably, again, it will depend on the governor of the state, but probably the first thing they will do is they will open businesses with limited hours, and also that they will make sure it doesn't have too many people. I think in India we are doing that. I know in Tamil Nadu we have the hours from 9 to 1, if I'm not wrong, and we are limiting the number of people working in that business also to be less. So I think that would be the priority if the lockdown does get open. Swimming pool, I would really not recommend until we have got a very definitive answer. Yes, we have, reduced the infection. So it will definitely depend on the state that you are living in. and this swimming pool, as from my experience, will not be the first. Next is so I think there was another question about
Doctor. There are a couple more questions related to this. So one has been asked by, can we go for walk in the apartment community? Can we go out for a walk?
Okay. So again, that will depend on Michigan. So as long as you have to be very cautious on what you're doing. So you can go for a walk. I know in Michigan, the government has said you can walk in free spaces with family members as long as you're maintaining a social distancing and you're not going to areas that is crowded. They have closed down the public, the parks, the play areas for a reason. So you can go around your apartment complexes, but just don't, stop and to talk with your neighbors. And even if you do, make sure you have the 6 feet distancing. So if you meet somebody, try to make sure you maintain a distance and you talk to them. I wouldn't advise gathering to them, giving shake hands. Please avoid shake hands or hugging, because we don't know if they have the virus or not. So yes, you can go around your apartment for walking as long as your apartment does not have the restriction for it. Second, please, if you see somebody walking around that don't get too close with them.
The next question, no. So the next question comes in more around COVID-19 and pregnancy. What type of care is required?
This is a good question, and I know a lot of my fellow moms, they were also asking me this. So basically, pregnancy, your hormones increases, you are prone to other infections. But as far as the studies that's done recently, and China, we did a retrospective study where we saw patients with COVID and pregnancy. The risk factor was pretty much similar. It was not more or it was not less compared to non-pregnant females. But what? Let me just go back. So what type of care? So I know a lot, around 113 patients in China, again, that was in that particular hospital. They were tested positive for COVID, but they are pregnant, they had the milder symptoms. Very few of them had severe symptoms, and the recovery was also okay. And I think, the babies born, they didn't test all the babies, but the babies born for these COVID positive, they were not showing they were not tested positive. So what care to be done? Again, so it depends on which trimester you are and how frequent is your doctor asking you to come. So usually in the third trimester is when, near your pregnancy delivery date is when usually we do the frequent visits. So again, speak with your doctor, ask if how often they want you to come for these visits. Second, if they do, some of the visits cannot be avoidable. So if you do go for these visits, make sure you don't take children or elders with you. If you can go by yourself, well and good, to be precautious. But if you have to take somebody else, I would just take one of your one adult, not an elder or a children. And try to, be very cautious when you're in the hospital. You can wear the mask, yes, and also whoever is coming with you, they can wear the mask if you have it. If not, I know there's a lot of cloth masks that's coming in, and some CDC is even recommending to wear the bandanas, just so if you don't have anything with you. And avoid touching any hospital surfaces which you don't have to. And you can carry a sanitizer or, other than if you don't have a sanitizer, the best is washing with soap and water. It's more effective than just the sanitizer. So just wash with soap and water. And as soon as you come home, again, go to the restroom, clean yourself, wash your hands. If you can take bath, do take bath, and please dispose, the clothes that you are wearing, please change it to other clothes just before you come in contact with other people in the house, just to avoid, transmitting the germs. These are the hypothesized effective measures again. And let me see, was there anything else? Yeah, you can.
So this,
If anybody is sick at home and you are pregnant, please try to maintain as much distance as you can. I hope that's not like if you have like 2 bedrooms and if one of the person is sick, the sick person should actually use a different the separate room, and all other people should use a different room. I know in another forum they asked me like what else can be done. So if that sick person, if you have a separate restroom, you please advise the sick person to use that restroom and the rest of the family use another restroom. If that situation is not available, then, the sick person, after they use the restroom, ask them to clean the restroom if they can. But if they are somebody who cannot do that, they are like too tired or too old or too sick, just assign one person to help the sick person. And that one person, please let that not be the pregnant person. So if there is another adult in the family, please they assign them, and that one person should be responsible for taking care of the sick person, and that one person should also avoid contact with the pregnant person. And yeah, that's pretty much
so,
it. Yeah.
so the next question is, the number of cases that are reported in Michigan or any other city, right? So there is a count of recoveries, that are being mentioned, but not to the substantial extent. So do you see a good recovery rate coming in? And if long, why is this numbers not reflected on the state counts?
So again, the recovery of from the COVID will vary depending on what that patient other comorbidities were. That's where we are we don't have the information in the USA. So for example, a patient who doesn't have any coexisting health conditions, his or her recovery might be better when compared to patients who have other comorbidities. Like so for somebody who has a very poor functioning heart or a poor functioning lungs, if this virus hits them, their recovery would be very poor. I think that's why the numbers are very deflecting, and until we have the full data about, what was, that is why, that's how the case reports help, like, what was the underlying condition of these people and how, and what was the outcome. That is how we can gauge it. But I know for sure that if the patient has an immune compromised state or if the patient has other comorbidities, their recovery is very challenging. But I have seen people who have had COVID, who has been intubated and did recover pretty good and was discharged. What was the other question, Sam? I got the first part. The second part I was lost.
No,
Or was
so
it
the
that?
second, no, the second part of it is, why is the state data not reflecting the recovery counts, right? Because people get scared looking at the death rate and the number of cases, of infected cases, but the recovery rate is not being shown to be positive on the media or on the state websites.
So I don't know where you're getting the recovery numbers. So usually I know hospital-wise they do give out the recovery numbers. So it will be, maybe it's because the patient is still in the hospital and on the way of getting recovered or way of getting extubated. So that's why they are not giving the numbers out. Usually, the only definite numbers we can give you is patient who is tested positive and patient who died. Those are the definitive numbers we can give you. If a patient is in between this, like it's in the verge of getting recovered, they don't give the numbers out unless they are discharged. And also, patient privacy is there as well. But again, I'm not sure from where you're getting the numbers of people who are not getting recovered. So the death rate is high, but the recovery rate is, it's right now we are doing a lot of, early screening, early intervention. So we are getting there, but, there might be a lag between both as well. But so far it's, how can I say? So this virus, it is having a very new presentation every day. So initially the only complication we noted was the respiratory failure, but every day by day, we are seeing the virus can cause other complications. Like I've seen people having bleeding problems. I've seen people having like gastritis, like what do you say, like stomach, like diarrhea as well. People having heart attacks. So these are the. So it will depend on which organ is hit, but a common outcome from this virus is the patient is having a multi-organ failure. So the recovery rate will be really slow in this case. So it will not be like on and off switch. It's going to be very gradual. So probably that's why you're seeing the number not equal and, with the lag in the numbers.
Okay, thank you, doctor. So the next question is, last 2 days, the number of confirmed cases are reduced drastically in Michigan. Any idea when the government will lift the lockdown ban?
So I know right now, as I said, last week or before that week, we were in the, rising peak. So we are right now, I wouldn't say we are plateaued. We are reaching that plateau phase. Like, hopefully we are going into the plateau phase, because even not only in Michigan, I know even in the US, like in New York mainly, it's still high. The number is still high, but it's not increasing. It's plateauing. So we hope it continues this way, and the only way that's the reason I think the governor also wanted to continue the social distancing for this month as well, because we don't want to wrap up things very fast and then regret about it. So the number of cases are coming down. It's mainly because of the social distancing, and we are testing it. So if this plateau continues steadily, yes, it should be pretty soon, at least by the end of the month or, the mid of the next month. But again, we need to see the steady plateau or even the decline in the curve, which is not happened yet. So based on that, we will be able to give a definitive answer. But I know if it continues to plateau as well, as I said, there will be a mitigation of how they are going to release it. So first will be the businesses, small businesses, they might open with restricted periods, and also social distancing will still continue at that time. And, hand hygiene is always going to be recommended.
Thank you, doctor. So the next question is, if major mode of transmission is through droplets, how is a person without a symptom spreading the virus?
Yes, that's a very good question. So sometimes, as I said, it is when people speak, you can also have, and you can be an asymptomatic carrier. So that's what we are researching about. As I said, the airborne or the droplet means of transmission is something we initially thought the virus, that's the way of transmission, but we are researching about it, and we are seeing a lot of asymptomatic carriers. So that's why that is pretty recent. We have discovered, or we are like analyzing it about. So the main, again, their means would be through airborne as well, like when you speak of, unnecessary spit or, close contact. That's how it's going to be spread as well. And that's why we are maintaining, even for them, the asymptomatic people, we are recommending social distancing. So there is no other means of spreading as far now, but in asymptomatic carriers, again, we are thinking like close contact, you might think you're not having a sniffles, but when you touch your nose, you might have some. Most commonly, the virus are in the anterior nares. So even touching the anterior nares, even though you don't have a sniffles, you might be having the virus in your hand. So, the flu, that's how it spread. The common cold, that's how it spread. So there's also a bacteria called staph, which is very commonly located in the front of your nose, and you might not even have the symptom, but you might be carrying it. So if you're a nose picker, and you don't have any symptoms, you are spreading it either way. So it's like, again, these are something we don't have definitive answers, but the only way we know is somehow from your nose or from coughing or, by touching those high risk areas, you are contaminating it. So that's how that's why we are researching this to see how else can it be spread. But I know for sure, like there's no other means other than the two ways that I just said.
Okay, so next question on the chat is, what measures should be taken after coming back from grocery stores? I think, this was answered.
Yeah.
Another question is, shall we eat outside food?
So eating outside food is, I'm laughing because that question is asked by my husband. So, yeah. So, if you don't have an option, yeah, go for it. But one thing is, be cautious from where you're getting those foods. So if you know this place, wherever you're getting the food to be safe and secure, go for it. But I would recommend rewarming the food really well, or heating the food even after you get it. Change the utensils. Again, there's no reported data, or like so far the cases that we have, nobody said like this is from where we got it, but we know other diseases which spread from food from outside. Example, like Chinese fried rice is known to cause diarrhea, like one of the bacteria can be. So reheating the food, really cooking the food would be an option. Again, it is an option recommended if you don't have a choice. If you cannot cook, if you're a healthcare worker who's working 24/7 and don't have the option to cook, yes, you can go for it.
I think we covered most of the questions on the chat. So I can unmute all the lines. If there is any question.
We still have. If you go up in the chat box, there are a couple more questions.
Already, okay. So
I think Krishna was asking about vaccines or treatment procedures found to recover completely. Okay, so vaccine is still under investigation, but it is not there yet. So to have a vaccine, there is a lot of process to go through. It's not like something you do it yesterday and you have it today. So there is like phase 1, phase 2, phase 3 of clinical trials. Then we do it on patients and we do it on public and see if it works, and then only we release it. But I can say that we are doing it pretty fast. The rate we are doing the vaccine developing process in US is very good, and it's very fast. That's happening. But the problem is we are not having enough people to test on. So we need like a control and a case. We need like a patient with the disease, and we need the patient without the disease. And we need to be a vaccine to be very effective. We need like a time period to test on. So, but despite all those, it is still in process. But I can say that we won't have the vaccine available at this time. The only timeline I think National Institute of Health is giving for they're shooting for 2021, which is pretty reasonable and pretty actually it's a very rapid, fast timeline compared to other vaccines that's been going on. And treatment, so there is so far a lot of medications have been tried for treatment of these infections. These treatment options, one is, again, as you all know, the malaria medicine, hydroxychloroquine or Plaquenil. So the reason we are using that medication, or we were thinking that medicine is going to work, is because that medicine kind of acts on a virus, or it acts on the shell of the virus, and it prevents the virus from coming out. So in China, a couple of studies showed that that was effective. But again, that was a very small study, and it had a lot of challenging or like debatable questions of like whether really it is affecting, it is having an effect on coronavirus per se. Second, the chloroquine, it has an effect on something called the cytokine syndrome. So what happens in this virus is like when you get a virus or a bacteria in your body immune kind of fights against it, okay? So the most of the symptoms that you're having for COVID is as a response of your body fighting this virus. So the cough and the sputum that you're producing is, the immunological reaction to it. So at some stage, what happens is like the body is trying to fight at it so fast and so rapidly and so aggressively, it can have something called cytokine storm. So you have like so much activity going on, so your body cannot take it, and that's how many people are resulting in like ventilator and like the adverse clinical events that you're seeing. So most of the medication that we are using is trying to calm or like act on these reactions, and we are seeing if that works. As of now, we don't have like one medicine that says yes, this is the only answer, this is the answer for this. Like for influenza, we have something called Tamiflu that you heard, which are shown to have effect, but we don't have that for this virus yet. But if you have a severe symptoms, we are there is a lot of trial medications that we are trying, and we are seeing, you know, if it has effect or not, because this is right now we are in the trial phase where we are doing a randomized clinical trial to see if the patient is improving or not. And we will know the numbers, or we'll know with the results only at the end. We will never know it at this time. So yeah, so I would not recommend. I know one of the common things that was coming out in WhatsApp was to take malaria medicines. I would not recommend to take it unless it was advised by a physician to you, because the malaria medicine does have a lot of side effects, and one of the side effects, it can affect your heart rhythm. It can slow your heart. So if you're a person who has an underlying heart problem and you take it, you can have complications from that as well. And if you're a person who are taking other medicines, you have to be very cautious of the cross interaction. So I would not advise people taking random medicines before consulting your primary care doctors. And again, back to normal life, I think. Sorry,
No,
go
so
ahead.
one more, so sorry, doctor, one more question related to that. How is the plasma treatment working out?
Okay, that's a very good question. And again, I know I'm saying the same thing, but everything is pretty new. So the plasma, the main like an outline of how it will work is like when I have the infection, as I said, my body is going to produce immune response. So the immune response is something called antibodies. So antibodies, like the virus is there, and the antibodies kind of holds the virus and tries to expel it out. Okay, so for some people, when they have very adequate antibodies, like they should have some antibody titers. So they should have high number of antibodies. And for those people, when we take their blood, we usually take only the plasma. So the plasma contains the major part of the antibodies. And when we give it to a very high risk, like very highly infected COVID patients, these antibodies will start, you know, it's like giving a medicine. It's like, so these antibodies are already ready to fight. So it's going to be more effective on these patients who have severe coronavirus. But I have to tell you this, at this time, we have like 3 things going on in US regarding this plasma. One is a clinical trial where we are studying about what's going on. And I know this, and one is for research purpose as well. And the third one is when we are using for emergency. So we are so the first one is the clinical trial or the research. The second is mostly in New York, we use it. And third is emergent. If you think a patient will really benefit, a patient, you know, you have tried all the treatment options, you've tried all the measures, and it's still not responding, then we can apply, we can try this plasma transfusion, but it has to go through healthcare facilities. Like, you know, the healthcare facility should be enrolled, and you can get the blood only from those registered areas. So it's not like it is readily available for everyone, because even for the clinical study and even for the for this treatment, you should have high number of antibodies. So we are still researching about how long this antibody is on patients who have recovered from coronavirus. So, and even the antibody in that patient, is it high enough to be given to somebody else? So it's all a debatable topic, but yes, it is something we are thinking it's a good choice to be used in patients who have, you know, all the measures are not working.
Okay. And you have seen good results, with that?
The hospital I'm working is not enrolled, but we are working on it. But again, I've not personally had a patient, but it is shown to have some effect. Again, it should be depending on how bad is it. So if the patient has multi-organ failure, like everything is shut down, the recovery might be questionable. You know, like it's something we are going to try and see if it's going to work. So that's where we are studying about and seeing, and I know a lot of patients in New York are getting enrolled to get it. The problem is we don't have enough donors. We don't have enough people who have recovered and have high antibodies to actually try it. So, we don't even have data about how these people are responding. But it's something we are thinking it should be a good option.
Okay. Thank you, Doctor. So any other questions from the floor?
Sarnana, there are a couple more. If you go in the chat box. Okay.
Which one?
I think.
So we covered the question on vaccine or treatment procedures and the counts, major mode of transmission. Can we walk in the apartment community? Measures taken, when we come back from grocery stores. Anything that I missed out, Anand?
Last 2 days. Okay. There was one question from Murthy. Since the last 2 days, the number of confirmed cases are reduced drastically in Michigan.
No, it's answered.
Okay.
It's answered.
I think we covered most of the questions from the chat session. Anybody has any questions? I can unmute all. Any questions?
So after May 1st, when we go back to work, what are the precautions we take other than covering our, wearing masks, maintaining social distancing? When we come home, there any other aggressive precautions that we have to take?
Okay, that's also a good question. So also I'm going to be I'm not sure if May 1st is the confirmed date yet, but nevertheless, whenever this lockdown gets cleared and whenever, they start, especially for software engineers to go back into the office, recommendation is, yes, continue to maintain the social distancing. If you can still avoid the meetings in a closed room, and I know before the lockdown started, there was a lot of meetings where even in the office you were doing via Zoom. I would also recommend continuing that. Continue, hand washing. You can wear the mask if you have the supplies, because right now, we don't want to pull the supplies from the healthcare workers. So if you have the supplies of masks, you are welcome to wear. And even when you're talking with if you can have a 6 feet distance between one cubicle to another, please do that as well. And cleaning the commonly used surfaces in that areas. So that needs a lot of help from the environment service workers. Cleaning them regularly is something to be done. Hand washing every time before and after touching the food, or, before and after touching the laptop. If you have a sanitizer by you, as frequently as you can. And after you come home from work, definitely, again, clean yourself, taking bath if you are, changing the clothes from work clothes to a home clothes before you come in contact with the rest of the family members is something we would recommend. And again, avoid the social get-togethers until we have reached that part of the mitigation in the lockdown, which would not be the initial phase. So, and also, I don't know, again, it will depend on your company's regulation, but if you can limit the hours, you can work in office and then, keep the rest at home, or the limit the days in office and the days at home could be one of the ways to, this is just the ways to avoid the social gathering, because that's one way. If you are an asymptomatic carrier, you can be spreading the virus. So, again, as I said, we are in a good, I would say we are in the place where we are supposed to be in the curve. And I hope the curve stays flat for at least the end of the month to get everything started again. But if you get, very excited and break these processes that's been happening, the curve might go up again, and we have to go back to square one. So these are the things you can start when you're initiating the process back to work after the lockdown.
Hi Suganya. So how we prepared for the second wave? Because a lot of things we're talking about the second wave. So how we prepared for that one?
So you mean like the second wave of the reinfection?
Yep.
Okay. So that again, like I know a lot of things are coming out, but it's not something that I've seen within the well-established medical community. I know a lot of things are saying like there is a second wave in China, there is a second wave happening. So this is the thing. The only way I can give you an answer for that is if we know the antibody testing in a person. So for example, I know in China once they were thinking of reinfection, and that in that study, that was again a small study, and in that study, the person was actually having the symptoms, was tested negative, and then he came back after a couple weeks, and that time he was tested positive. So the question was like, was it a reinfection or was it the first infection where the initial test was not significant, or the initial virus load was not significant enough to have significant symptoms, and the virus then accumulated, or your body was responding it too like very aggressively that your symptom worsened, and then you tested positive. So the only way we will know is to see about how much antibodies you have, because antibodies are very good protective a way of protective inside your body. That's why we were recommending vaccines for flu, because vaccines, they have the antibodies that can fight against the virus. The similar case would be for this. So we have to see how much, if the second wave, even for example, a patient who had a COVID got recovered and came back, the only way we'll know if it is a reinfection or if it's just the old infection that is still going on is by knowing the antibody levels in your body. If this antibody level initially was high, then came down, and then the antigen level, that means that is the virus, is again peaking, then yes, you might have the reinfection. But we don't have these data at this time, so I'm not sure when there is, I know a lot of news do say that, so it's something to be questioned about, and we cannot give a definitive answer until we have those numbers with us.
Thank you, Doctor.
So any more questions?
So I'll just like to say something like, I know this is how mitigation works. Like before this lockdown even starts, this is something I read from a recent journal, medical journal with Dr. Fauci and other people. And so what they usually do, like usually in this pandemic, is they will start, again, I'm not sure if it's going to happen in the US, but that is the approach usually the government should take and will take. So they will start tracing people. So they will trust, one is they will do more tests on everybody, and including people who are asymptomatic, and they are going to see how far or how much is the virus in that community. So, and as I hope, so once they find that, and they will see, like for example, I have the virus and I was not symptomatic, but my virus load is high, then they will check all the people who were close with me, they will test those people, okay? So they will test my husband, they're going to test my son, and then they will keep like tracing, and whoever so around my area, they are going to be doing the testing. And once they find like it was just me who had the virus load and everybody around my locality was not having enough virus, that's when they will say this area is safe to open. So I'm just showing in like a narrow area. So, but this is how they are going to do state-wise. So, they are going to go very slow. They are going to, I'm pretty sure they're going to start doing more testing in New York, everywhere, and they're going to do the contact tracing. And that's when they will slowly release the lockdown. But before even that happens, there's a lot of steps to be done. So I know a lot of people are very afraid, like very fed up with this lockdown. They want to, start going back to normal life, but they don't understand what are the mitigations to be done even before we go there. Okay, we should have enough supplies ready, and we should have enough tests with us before we break the lockdown, because we want to test people and the results should be readily available, because we cannot risk going back to the, another pandemic just because of, breaking the lockdown for people request. So it has a lot of mitigation process, and I'm sure, and I know that the U.S. Health Department, the Center for Disease Control, and the National Institute of Health is working on these mitigation process before they can say, yes, it's gonna. So I want you guys to understand that it's not a simple step to say like, yes, tomorrow is a day to go out safe. They have to see the activity around each area. And as I said, it's going to be different. In Novi, it might be less. And in Detroit, it might be more. So the lockdown might be released sooner in Novi, and it might be delayed in Detroit. And people who are going to work from Novi to Detroit, that's a question we are going to ask. That's a question, we healthcare workers are thinking, what would be the case? So that's why I'm saying going to work might not be the first step when a lockdown gets released. So first step will be like opening small businesses, or opening the clinics. Again, even in the clinics, in the small clinics which been shut down, they will make sure there's limiting restriction, number of patients coming, and the time it's been open. Then they will go to probably workplace, and again there also they will limit the people. So it is very variable and very different, but I would highly recommend you guys to continue whatever you're doing at this time, because it's working. I know you cannot see it. You feel like everything is getting better. I don't know, in the news and stuff, I don't know what they're saying, but I would really recommend to follow what the local government and the President of the United States has to say, but just don't rush it, because I did see a lot of people getting together and asking to break the lockdown, but they have not seen what's happening in the hospital. And, we are seeing a good trend, which I don't want to be jinxed at this time just because we are breaking the lockdown at this time. Hope that makes sense. I'm sorry.
Yeah, thank you. That really helps, Doctor. So any other questions? Otherwise we can wrap up the session. So any questions, if you have any last questions, put it on the chat. Just a minute, a couple of minutes before that. Right. So no more questions. Okay, let's wait for another minute.
I would like also to tell, I don't know if this was not a question asked here, but if you have kids, a lot of people were asking what to do in that case. So usually, so far, the number of cases reported in kids are very minimal. I know in China, less than the number of cases seen in patients less than 19 of age was very less as well. So the cases in kids are less or to none, but kids are known to be asymptomatic carriers. So that's why we are recommending to continue the social isolation with them. So we are also not recommending them to go have like a play date or, have the birthday parties together or having a lot of children in the same room. And if you have kids and if there is an elderly people with you, staying with you, please avoid close contact between those two persons, even though the elderly and the child does not have the symptoms, because they can be asymptomatic carrier, and you always know the children always have a runny nose. So you don't want them to be the source of infection for your mother or your father that lives in the same roof. And also ask them, washing hands and all. Again, it's very hard for kids to be locked down in the room, but I know kids right now are actually, my son is very supportive. So just be cautious with the kids as well. ask them to wash your hands. If they don't take them to groceries with you, and if you have an area behind your home or in your apartment, like a lawn or something to use it, yes. But in an apartment, I would actually advise not to use the common play area, because you might be the only kid playing at that time, but there might be other kids before, and we never know how the where the kid has, or if the kid has the symptoms, and you don't want to have the infection.
Thank you, doctor. I think alrighty. So there was a question from Preetham. Seems like he joined late. He wanted to reiterate the grocery guidelines again.
All right. Hi, Preetham. So this is the thing. There's no guidelines as such, but if you're going to the grocery, I know a lot of groceries are doing online delivery. If you can do it, go for it. If you have to go to the grocery, just only one person is advised to go. Don't take your family with you. Don't take your kids or elderly person with you. If you can wear a mask, well and good. If not, wear a cloth or a bandana. Try to clean those strollers or anything if there's available. Again, those are not like effective measures, but please try it. And all the stuff that you get in the groceries, when you come back, as I was telling, so it's not like proven that the infection is happening or spreading through these substances, but the virus is found to be living in plastics and steel for 72 hours. So what is the recommendation is, if it is a non-essential substance, or it is a substance that does not have to be brought inside the house immediately, you can leave it outside for at least 3 days, because although it lives in the substance for 3 days, the infectivity of the substance kind of declines after 12 to 24, like I would say 12 hours. That is like infectivity, meaning like the risk of it causing an infection would decrease. And yes, you can clean the outer layer with the regular the Clorox or the disinfecting wipes. And if it's a food or something that you have brought in, well, cook it, just like a high heat. Cooking them with high heat has shown to kill the bacteria or the viruses in the past. So that should be applicable with corona as well. And buy the food, and especially if you're buying outside food or outside meat, buy it from resources that is trusted. Don't buy it from like high-risk areas or high-risk persons. But cook these areas. If it's a milk, highly boil it before you're using it. I have not seen any data where the virus has gone inside the cartoon of the milk. But you can be precautious by like really heating the milk and before drinking. Wash your hands after you come from the groceries. Well, if you also change, you can have you can bathe yourself, clean yourself up, and change from the grocery store clothes to a new clothes, just so you don't have the virus on you and you don't transmit it to the people who were inside the house. I think somebody was asking, do we need to wear the mask all the time when we are out? Yeah, you can. It's better to wear the mask if you're outside, again, because we don't know who you're going to come in contact with. Again, these recommendations are changing very rapidly. When this pandemic started, it was not a recommendation we were giving to people. But as I was telling to the other person, since right now we are seeing a lot of asymptomatic carriers, we are recommending to wear the mask. But you should all know there is a shortage for masks. Hospitals are trying to get these supplies for healthcare workers, because we are dealing firsthand with the patients who have the disease. So if you don't have the mask, you can go for a homemade cloth mask, or you can wear the bandanas. I don't want you guys to fight with a healthcare worker to get the mask just so you have to wear it. But if you can stay home, you don't even have to wear these masks, right? I think that's it.
That's it. I think most of the questions were addressed. Alrighty. So thank you so much, Dr. Anna, for taking time from your personal time and doing this session with us. Thanks from the VIT Alumni Association, and thanks from everybody who's on this call.
Thank you for giving the opportunity.